My name's Will Mather. Today's date is Saturday the 21st of September 2024, and I'm going to answer questions on physical interventions and the implications of their use.
Number one, identify the risk factors involved with the use of physical intervention.
The risk factors are you could cause trauma, emotional trauma, death being the worst case scenario, or any type of injury.
Number two, recognise the signs and symptoms associated with acute behavioural disturbance and psychosis.
So ABD, or acute behavioural disturbance, that'll be things like high temperature, bizarre behaviour, and the psychosis is paranoia, delusions, and hallucinations.
Okay. Number three, state the specific risks associated with positional asphyxia.
Positional asphyxia, you could be pressing someone against a wall, slumping them forward in a seat or walking, or you've got them on the floor and you're kneeling on them. So you're causing problems with them breathing, which could lead to death, or if they do survive, possible brain damage. So you're stopping them breathing, aren't you?
Any other risks might be?
Risk with positional asphyxia. There's another one I'm going to come on to on the next question. Can't even think of any others now.
A couple of injuries to the participant when you're holding them in that position.
Right, okay, yeah. That's what I was going to come on to on the next one.
Okay.
Yeah.
State the specific risks associated with prolonged physical intervention.
Okay, so prolonged physical interventions are 30 minutes or more. Really nobody should have to hold someone for that length of time. But the possible injuries are, again, breathing, but there's also, you could cause someone blood clots, because you're stopping the blood from circulating around the body, depending on what position you hold them in. If you do hold them for a long time, 30 minutes or more, paramedics are likely to be needed, and you should let the paramedic know how long you've held that person and in what position, so then they know what treatment to give to the patient.
Okay, number five, identify how to deal with physical intervention on the ground appropriately.
Okay, so we try and avoid putting people to the ground, but if we have to, then while you're restraining the subject, your colleague could be monitoring them, speaking to them, maintaining dialogue, carry on communicating. But you're looking for red flags as well, making sure that they're talking okay, because incoherent speech could be one that you need to identify. Yeah.
Okay, number six, state how to manage and monitor a person's safety during physical intervention. Okay,
some of the red flags I've already mentioned, but there's other things like blueness around the lips or fingernails, they're signs of asphyxia, you stop them breathing. Are they vomiting? Are they passing out? Have reduced consciousness? Other red flags? You need to make sure that you're monitoring the person's bones. Before, what I always tell the classes that we have is, before you're physical with anyone or you're hands-on with anyone, be mindful that they could have had surgery, we just don't know. Not only that, they could have illnesses, it could be because they're elderly. You just got to be careful when it comes to bones or joints, especially the head, the neck, the spine. Yeah, that's it.
Thank you.
Thank you.